Assalamu alaikum wa rahmatullahi wa barakatuhu. Once again, we most welcome our cherished viewer to your program, Health Checker program, where we bring medical experts to help us understand and overcome certain ailments affecting our bodies. With me today, once again, is Dr. Kange Abubakar. You're most welcome.
Thank you.
Was welcome to the program. This is the second, actually it's the third time he's coming to our program. Thanks once again for honoring our invitation. And the topic of discussion today is Ebola. It is the disease that is making headlines nowadays in East Africa, most especially here in Uganda, and some of the hospitals have a few contracts or people that have contracted this disease. How to fight it, how to overcome it, how to prevent it. This is the main reason we have Dr. Kange Abubakar. The very first question straight away should be, what is Ebola?
Thank you for this opportunity and for always inviting us to come here and talk about the challenges which our communities are always facing. And currently, as you mentioned, one of them is Ebola.
Yes.
Ebola, it is now coming to about 50 years since it was first identified.
Okay.
If we are to look back in 1976, is when we first had the cases of Ebola identified, and it was simultaneous. The first case was in Sudan, by currently South Sudan, and another case was in the Democratic Republic of Congo, in a village near the Ebola River, and that's where it gets its name, the Ebola virus.
Okay.
Previously, the names have kept shifting. Previously, it was called the Ebola hemorrhagic fever, but since the bleeding, the hemorrhage wasn't a universal situation, it wasn't a universal occurrence in all cases of Ebola, so it was changed to Ebola virus disease. And we find that the Ebola virus belongs to a family of Filoviridae, and in that family we have about 3 genera. Okay. That is the Chueva virus, and the Marburg virus, and the Ebola itself. And the Ebola virus itself has about 6 species, and one is the one of Zaire and one of Sudan. Okay. So currently here we have in Uganda one which is the Sudan strain, which is here. So to simply define it, I can say Ebola virus disease is a fatal illness, severe in nature, which affects human beings, caused by the Ebola virus.
Thank you so much, Dr. Abubakar Kange. Now this takes me to how one contracts the disease. How does one get affected?
The Ebola virus is naturally occurring. It has its natural hosts as the fruit bats. There are some bats, some type of bats where it is there occurring naturally, and also some primates. So from there, from the wild to human beings, it means that the human beings get into contact with the infected, either infected bats, which have it, or the infected animals, or maybe the wild game. When they are hunting, they get into contact with the infected animals which have the virus, and it gets to the humans. So under the humans, the human-to-human transmission, we always have issues where if a person gets into contact with the body fluid, and if we are talking about the body fluids of an infected person, we are looking at almost all fluids which come out of you. We are looking at sweat. We are looking at vomiting.
Saliva.
We are looking at saliva. We are looking at semen from an infected person. And also, when this virus gets into contact with those objects around that infected person, that means also those objects are capable of transmitting the virus to an individual.
Sounds so infectious and very dangerous. Thank you so much. And doctor, when we talk about symptoms, how does one know that she has Ebola?
Always, like almost all viruses, they present in the starting period. They present in the same way with the flu, just like the other viruses, you know. They will present with flu, and it is not an exception to Ebola virus. So you will find that someone in the first 72 hours, they present with the flu symptoms, like you can have a fever, you can have a headache, you can have muscle pain, you can have weakness, or even the most common one, a sore throat. But as the disease progresses with time, you find that you will have involvement of other systems. You will start to vomit, you will start to diarrhea, you will develop a rash. And because of this excessive loss of water from the body, you will start to impair your kidneys. You will have impaired kidneys, and you also have the impaired liver. And as the disease progresses with no intervention, you will have in severe cases, you will have internal or external bleeding. If someone passes the stool, they will be blood stained. The vomiting, the vomiters will be blood stained. And in most cases, it leads to death if no intervention has been done, or if someone's body is so weakened that they can't fight it off.
So this is how dangerous it is.
That is how dangerous it is.
Wow, wow. In case you see any of the symptoms that has been mentioned by the doctor, please hurry up, go and seek medical advice from your medical experts as fast as you can. Doctor, let's talk now about the preventive measures on how to prevent or to stop the outbreak or the spread of this Ebola.
With Ebola, when we identify any case, we always declare that it's an emergency. It's always a national emergency. So in most cases, what we look at is to prevent the spread of the Ebola virus disease. And one first thing we always do is to isolate the infected individuals.
Okay.
And that's why you realize that here in our country, isolation centers were immediately set up where those patients who contracted the virus were going to be managed. And also is to start or encourage proper hygiene, like washing your hands with soap, because this soap is very helpful that the soap will pierce this virus or even create a barrier around it that it will not spread to other people. Also, we have safe barrier practices to prevent transmission from the deceased person, because by the time a person passes on from the Ebola virus disease, at that time of death, our understanding of this disease, we find that the highest viral load is always at that point when a person dies. So it is always better that the well-trained personnel conduct the burial of that person when they pass on. We have the SOPs, the standard operating procedures we follow when we are conducting the burial of the person who has passed on due to the Ebola virus disease. And we always encourage people not to get close, and they should be very understanding in that situation. Also, we do contact tracing to identify and monitor those who have been in contact with the person who was affected. Yes, who was affected by Ebola virus disease. We look for the relatives wherever they went. We have to isolate those
where
people.
The friend has been living before.
Exactly, yes, and we monitor if they are going to develop any symptoms.
Places of work.
Yes, exactly, because Ebola, within about the first 3 days, the symptoms start, and within 10 days we know if you have or you don't have. Okay. Also, we have to educate our public about the spread of Ebola and how one can prevent or protect themselves from getting Ebola virus.
Thank you so much, Dr. Abubakar. Let's now talk about the treatment. Should we have any hopes that Ebola is curable, or if someone is contracted, that's the end of their lives?
In the management of Ebola, we always look at, because with most viruses, if the body is supported, can always fight off the virus in most cases. So the management here we give, currently we do not have a specific treatment plan, a specific treatment for the Ebola virus, but we have supportive measures we use to try to support the body of that person. For example, they are losing a lot of fluids, a lot of water from their body. So we shall hydrate them very well, and also make sure that we maintain the vital signs. For example, we have to make sure that their blood pressure is within the good range, the normal range. We have to make sure that their temperature is okay, it's not going up. We give the treatment which will help us with controlling that fever. We also make sure that their oxygen saturation, how they are breathing, is within a range. If not, we give them supplementary oxygen in that situation. However, with the specific treatment, we have seen advances. Now we have what they call monoclonal antibodies. They have shown to also improve the survival rates of those people who contract the Ebola virus. Okay. And also, currently we have vaccines for the Ebola which they are rolling out. For example, me personally, I had actually, about 6 years ago, I had my first Ebola vaccine by then. It was the RVSV, Zebov. And currently also here, after the pandemic, after the outbreak was declared, they are rolling out vaccines to the healthcare providers, those who easily get into contact with the infected people. Okay. And also those who are at high risk of contracting the disease. Okay. So we have vaccines now available.
You've talked of the symptoms, and they are quite easily for someone to understand that this such and such a person has Ebola now. What should our layman person there, the one that is viewing or watching us right now, in case they find out that someone has Ebola, what advice do you give them? What should they do?
When our people, you suspect that someone maybe has Ebola virus disease, the first thing is do not panic. And the next step is to alert the health authorities about your suspected case of Ebola. The most authorities have given out to the toll lines the numbers which people can call on, so that a response team can be sent to come and get into direct contact with that person. And also, for you as a person to avoid direct contact with that person, and to make sure that in case you suspect that you might be having Ebola, ensure that you receive your treatment from these designated places they have put around there for treatment of Ebola specifically. Do not be there into hiding. Come out and you get support. Okay,
thank you so much. Ebola is not happening for the first time here in Uganda. We have the DRC Congo Ebola that happened some time back, and you said it is around 50 years now, you mentioned?
Close to 50
Close to 50 years when 49. It was first discovered. And we have now the Sudanese currently that is happening here in Uganda, the Sudanese Ebola, and it happened in West Africa some time back. What lessons should the community and you, the doctors, should have learned from this Ebola?
These outbreaks have taught us a lot over the years, and one of the ways that we have learned, the things they have taught us, is to always do rapid responses in that we are able to contain the virus, and also to engage the community like what we are doing here today, to sensitize people to know about Ebola virus, to also reduce the stigma, and also to ensure that they comply with the health guidelines which have been put in place. And also, we have seen international cooperation for resources and expertise. You find that even in situations where some governments are calling off support to some countries, but in the case of such emergencies, we see them coming up and sending specialists in specific fields to help out to fight such outbreaks. And we have also strengthened our health care systems to handle such crises in case they arise, and they always find us prepared.
In the past history, the governments have managed to fight this Ebola disease in some countries. Here in Uganda, where I live, and West Africa, it is no more. But this does not mean that it has stopped. Yes. At any time. In the future, we expect that it might appear once or yet again. How prepared are you for the next or coming outbreaks of Ebola?
This time round, these outbreaks have found us always prepared, and we have had a significant improvement in our preparedness. For example, currently we have better surveillance systems. We have more trained personnel. We have trained doctors and specialists to manage these situations. And we also have, for example, I told you about the vaccines. Now we have them in good stock, in that we are rolling them out to the population. And also the treatment itself, we have always tried to provide that. And also, one important thing which I have to mention is that this does not take away our vigilance. We should maintain being vigilant, and also to keep our health infrastructure robust, and also to continue educating our communities about these diseases, okay, most especially which are always fatal.
Thank you so much, Dr. Abubakar Kange, for such enlightenment. It has been a wonderful program indeed, and thanks a lot for the advice regarding this outbreak, or the new outbreak of Ebola. It's a new its kind coming from Sudan. Thank you so much. But before we close, do you have any thoughts before we conclude?
Yes.
The final thoughts that you might give to our viewer.
One, the Sudan type which is here is not really new. It has been here with us, so we know how to manage it.
I've heard it of the first time, maybe you, the doctor.
Yes, because
you know much about it, yes?
These names have been assigned to them depending on where that virus was was first identified. Like, for example, the Zaire, maybe you will hear about the Zaire Ebola.
Yes.
That means the first case was identified there in Congo. And this one, which is currently here in Uganda, was first identified in Sudan. Yes. That's why it is called the Sudan type.
Okay.
What our people have to know is that they should stay informed about these conditions, most especially Ebola virus disease. And they should also practice good hygiene. For example, in our communities also, I have to mention about this, most of our people, our culture, when you find someone, you want to hug them, you want to shake hands, you want to kiss them. So during such situations, we discourage such acts, because you are going to get into contact with someone, you don't know if they have the Ebola virus disease. You can equally greet someone with a space, like how we did it previously during the COVID-19 time, that you maintain some distance, do not get into contact with with people directly, and also to remember and to avoid fear and the stigma, which is always more damaging, like the virus itself. When someone is sick, just alert the health care authorities so that they come and get into contact with that person. And also, we should make sure that we work together and keep our communities safe.
Okay.
In that we can always overcome these challenges which come our way.
Oh, thank you so much, Dr. Abubakar. Unfortunately, that's what all time could allow us to give you. We had prepared a lot, but this is what time said is enough for you today. But the good news is we still have some time in the near future. Just tune in MTSM time. We have still cooked something for you in as far as the health check is concerned. For now, let me say assalamu alaikum wa rahmatullahi wa barakatuh. See you.